I'll repeat that. We on now? I'm sorry. Our next lecturer is Vera Stejskal. She was born in Prague, Czechoslovakia, where she got her PhD at Charles University in Prague in biology, chemistry, and specialized in immunology. In 1968, she left the country a week following the invasion by our wonderful Russian friends, where she went to Stockholm, Sweden. She worked in the field of cellular immunology at Stockholm's University from 1969 to 1977, when she became the chair of Associated Professor of Immunology. In 1978, she joined Astra Pharmaceutical in Södertälje, I say that right? Close? South of Stockholm, where she established the section of immunotoxicology. In her work, she has produced over 50 articles which have appeared in peer-reviewed journals, most of them dealing with immunotoxic effects of chemicals and metals on mankind. She holds a European patent on her ELISA test, which she's going to discuss today for us. May I introduce Vera Stejskal. Do you have a pocket for this somewhere?
I don't have a pocket now.
Put this here.
There's
a clip there.
Yeah, I think I put it here.
Got it?
Okay.
Good.
Yeah, okay.
Here's a pointer if you need this.
Yeah.
And you have crayons.
And this is it. Okay.
And you want to speak to this?
I think I have to take it out.
Yeah.
Okay. Okay.
Just let me know.
Yeah. Thank you, Chris. Thank you, Family Arena, to inviting me. Thank you to Ed, which is my old term friend, and we have met several times, both here in Carmel, in Puerto Vallarta, which many of you, I see the dear faces here again, a group of people who are open-minded and who are not afraid of the mainstream policy. And I am back here again to share with you our latest development on the metal-induced sensitivity and allergy. And I will try to keep it as simple as possible, which is quite impossible task because immunology is everything except simple. But I think many of you will understand that most difficult things are very often the most simple ones. So at the end, I think we understand each other. May I have the first slide, if you can put it on, and then I will do it. By this, I would also cordially invite you to visit us in summer in Stockholm, in the country of midnight sun, in Stockholm. And a couple of years ago, we have organized a group of international ELISA study group, which is using this ELISA test I'm going to talk about. And there is a meeting in the Alps in April, when I hopefully Dieter will play guitar. And then in July, we will repeat this, hopefully in Stockholm. So there is handouts about these two seminars at the entrance, and if you are heading for Europe for holidays and so please get and visit us. I am immunotoxicologist and I deal with allergy. And as you certainly know, allergy is nothing which is just acquired at the dentistry office. Allergy is something which is acquired very, very early in our life. It's actually acquired already when we are born. If your mother is uncareful, or if your father is a dentist which doesn't change the clothes coming home, then you can be sure that such unfortunate kid will be. Could you focus that? Is it possible to focus a little bit?
Excuse me, what do you mean by changing clothes?
Changing clothes is that means if you are drilling amalgam a whole day and come home to your bedroom and change the clothes, getting your amalgam coated clothes on the bed, and then if you have a 7-year-old child, this is a real happening, and he starts to be bad off at school, it doesn't mean that he is stupid. It means that he is chronically exposed by mercury from your clothes. That's what I mean. And this is what happened, so that's what I am talking about it. If you are not taking precautions, you can actually poison whole your home, which may be, and tragic results like that may be suicide of your wife. This also happened. I don't say this is, yeah, because the wife was washing the clothes of this dentist, getting depressions and so on. So this is the start, and then, of course, you don't only have dental fillings which will implant metal ions in your body. You also have a lot of pharmaceuticals which are conserved by thimerosal, which is ethyl mercury, organic thiosalicylate. And you also have phenylmercury there, which is also planted into our children, and by chronic repeated injection, there may be quite a few people who become sensitized to these things. And then we should be aware of the fact that, that our environment, our modern way of living, it's a very dangerous one, and we are planting again metal ions, toxic metal ions like lead, like cadmium as a metal colorings in, for example, in cosmetics. And we also have colorings which are in our foods, like titanium dioxide, which is a white titanium color, which is also not innocent as you may think it. Next, we will see. Try to put this out. Of course, the central point of our gathering here are teeth, so I will not forget that. And what I just want to stress here, that everything you put on the teeth, under the teeth, and nearby the teeth will, as Dieter said, end up in all your body, not only in the brain, but in all your body, in joints and everywhere. And this is because the tooth is a part of our body. That means everything goes into the lymph and everything goes into the nodes. It's not that it's just leakage out passive and settings on the proteins, because all these metal ions which are corroding are virtually absorbed on the autologous proteins. There is also something which is called active transport, and this is by special type of lymphoid cells, so-called macrophages, which will engulf these metal ions, and by the blood and by lympha it will be released all over the bodies, even into the most distant parts. And this is nothing which is new. Actually, every person working with prosthesis, like hip prosthesis or knee prosthesis, knows that, and these things are called wearing products. So they are found in distant part of the body, they are released. There is nothing, there is not a single implant which is inert. If you learn that, forget that. Everything is released because we have very, very rough, very aggressive system, and our body is doing everything to get rid of implant. So body is fighting against you, dentist, of course. And you also know many cases when you do a beautiful gold alloy bridge and the patients come back and say, well, it's out again, and then you glue it in and he comes week after and say it's out again. It happens to us that there are such people who are allergic to palladium or gold, and the body just wants to get rid of that. So well, this is a sort of uneven fight which ends with the patient get chronic multiple sclerosis or chronic fatigue. And the point here is how to prove it. What the body likes and what material it will be tolerated, and what material will not be tolerated. And this is what's all about. How can we test? This is just a couple of E numbers, and I know that you have the same. We have it in EEC, in European communities, all the European wild plaque. And these small E numbers means that you have in the food or you have in pharmaceutical products titanium oxide, which is E171, Ions, which is of course not good at all. You know that all these things are transition metals and promote free radical formations, so it's not definitely good to have it as a coating of our pills, which you give, or not you, but other people give on long-term basis treatment for example, psychiatric treatment. And then we also have silver, gold, if you didn't know that, and aluminium. As a part of our pharmaceutical products, parts of vitamin coatings as well. So you have to be pretty selective getting minerals and vitamins to get it from good source, because otherwise you may at the same time have a passenger toxic metals which will counteract, of course, all your good things done with vitamins. I am not a toxicologist, but I know that that most of the work done with heavy metals has been done by toxicologists. And just to show you one single slide, which tells everything. This is a little mouse which has been given into IV, into the tail, a little of radioactively labeled inorganic mercury salt. Just a little one. You could say that it's comparable with the things which if you have 20 amalgam fillings, so per day, it's about the same. And then 6 weeks after this, we have done a whole body autoradiography. At Astra, we have autoradiography departments, which all new compounds, which will be drugs, are of course searched where they are binding in the body. And instead of drug, we have now taken this radioactively labeled mercury. And where do you have these white spots? That means that's where mercury bound and landed. And I will not show you the whole mouse. It's everywhere. It's in the stomach. It's in the trachea. It's in the brain. It's in the lacrimal glands, and it's in the spine. As you see that intercalary disc in the spine, they will have it. So there is nothing to discuss actually concerning the danger of mercury and other heavy metals. They will bind to the body enzymes and body proteins everywhere where you have SH groups. And since methionine and cysteines are 2 amino acids which whole body is made of, be sure that they will bind everywhere. So it's actually no question that it is there and it's a potentially dangerous. The whole discussion now is if you are on the toxicology level, meaning if everybody has this, everybody binds this and these places, and this is true, everybody does, why the hell that we are sitting here? Why aren't we thick, all of us? This is the question. And this is always, it's coming up that, how the hell that we survive? Huh? And I am going to talk about individual sensitivity. It's on the biochemical level and it's immunological level. On the biochemical level, it's very difficult because we still are lacking many diagnostic tests. We have some, but we do not have many. On immunology level, it's a little better because we can, and the animal level already prove that by your genetic makeup, you are either the lucky one, survivor, or the unfortunate one, non-survivor or short-term survivor. And the question is, can we somehow screen the patients, screen the dentist? We will be at the risk for this low-dose chronic exposure to metals. But there is no doubt that potentially everybody is at risk. So please, talking about immunology and biochemistry, it's not all or none phenomenon. It's not that everybody will drop dead like in Japan. This is what is the hideous thing, and this is why you have many people who can make it and who can deal with amalgams without overt toxic effects. Sooner or later, they will be caught as well, but not maybe at the time being. While other people, exactly at the same type of exposure, will develop systemic diseases. This is what's all about. And there are the ways now how to find out and how to protect these people who are at the risk. I was always wondered, since I got a daughter which is allergic, also atopic one, why it's so clear-cut that these hideous low-dose exposures are completely recognized in animal species. And you know that there are whole centers in Europe who are studying infertility of sea animals, for example. And why are they dying off by immunosuppression, why they are dying off by some hideous viruses, and everybody agrees, of course, it's pollution in the sea. There is no controversy about that. When you come to our finest species, our kids, I am thinking still in America there are a couple of dentists which are placing amalgam in their mouths. And I can't explain this. This is something which I don't understand. It's not just America, it's the same in Europe as well. So please, these things are still going on, criminal things. And many people told me here, well, we are so happy, Sweden it's on the verge and you already abandoned amalgam. Unfortunately, I have to say, since we became members of EEC, European Communities, we may not have achieved this, because there are other countries now who are trying to override us. So please, we have to work together and we have to finish off these evil things which is going on, placing metals and poison into the our little ones and their little ones. This is the small animal which look, I told you about. They are the white blood cells which are collecting the garbage from our body. It's small grains. These are chromium suspensions in vitro added to lymphocytes and macrophages. And these things are forever. This is the bad things about this, and this is the things which you usually do not think about. Regardless if it's silver, if it's platinum, if it's titanium, or it's chromium, or if it's mercury, we did not develop any enzyme systems which are able to get rid of these things. It's pollution forever. It was never intended that we will harbor metals in our body. That's why we do not have any protection to that. And I told you already, it will bind to everything which will make, and it will change the antigenic makeup, and it may trigger in sensitive individuals autoimmune diseases. This is just part of the body, but maybe this is enough. I just want to show you, and couldn't you put this down? Because the thing which I want to show, it's actually at the head. This is lymph system, and all these whitish things here are the places where you can, yeah, that's better, when you can harbor white blood cells. And again, if you could try to sharpen it a little bit so you can read. It's adenoids, tonsils, and lymph node cells, and all over the oral cavity you have a lot of lymphoid organs. The same here in the stomach. So any sort of intervention in the body, in the oral cavity, when you drill the metals, will automatically expose immunocompetent cells in oral cavity and in the gastrointestinal tract, with the hideous impacts as follow. Because you know we are not sterile, we have bacteria in our mouth, we have bacteria in our stomach, and these bacteria transform inorganic form of mercury to organic ones. So you have Streptococcus mutans, carini, which are in the oral cavity, and there is reported and published that they may transform inorganic mercury to organic mercury. And that's why I liked very much your approach for neurotherapy, because you really try to get into the brain, because that is where organic mercury ends up. And there are data published that if you compare the concentration of metal mercury in the blood of people with those one working in dentistry, the concentration of metal mercury in the blood of dentists is much higher. It's not because they are eating more fish. I don't think so. Yeah. This is just to remind you again the systemic effect of metal allergies. This is a little ear, and then at the end we are in this connection with this. If you just can put it up a little bit, yeah. So you see this inflammation, which is due to intolerance to metal earrings, showing to you that this person, which do not, these people, especially women, which do not tolerate metal earrings, they are the one which will not tolerate metals anywhere. I mean, so it's very simple. If you have a person and you are maybe thinking one should use a metal alloy of some size, and if this person has not earrings and tells you, well, I can't have it because I get inflammation there, please do not place any metal earrings, because this may result in a lot of problems or the patient which not then correlate to the bridge, because they are systemic, distant effect, like depression, like chronic fatigue, like fibromyalgia. And very often these people will not come back to the dentist and complain about that. They will go to the doctor, which will of course never ask about dentistry. So these things are very difficult. And this is again the ring here, intolerance to jewelry here. Yeah. This is a sort of overview of things which is not apparent if you are not working in immunology, but it's quite apparent to people who are in the business. And this is what I already told you. Everybody is in peace with his body if the body is clean and if the body is obeying the normal rules. That means making a counter with bacteria and viruses. But when we put on metal load, then we will dysregulate the immune system. We will tip off the balance. There will be immunosuppression locally by the extremely amounts of metal debris in the mouth. And then in the stunned part of the body, there will be this reaction, autoimmune reaction. The metals will bind to SH groups and other groups. They will change the antigenic makeup of the cells, and they will trigger the cells to respond to this so-called epitope. It's only the problem is that they will not, such lymphocytes will not just kill off the metal. They will not be able to do that anyway, because I told you metals are not possible to degrade. But at the same time, they will kill off your nerve cells. They will kill myelin basic feet on your nerve cells, because metal is stored there. So this reaction, horror autotoxicus, is triggered by metals. This is nothing which is disputed somehow. In animal studies, it has been done for 20 years by 20 different laboratories. You have animals which are completely healthy and stay healthy if you give them low doses of metals, for example, mercury or gold or palladium. But you have other inbred species of animals which have other genetic makeup, and these will not stay healthy. They will develop autoimmune disease. So this is nothing special about that. It's just that in man we are very outbred, so we can't perform and control studies. The only studies which can look on genetics is if you have identical twins. So then you can see that quite a few of those have sort of the same diseases. Myself, we have published the data on twins which has chronic fatigue and which have the same responsiveness to metals. since I told you that allergy is something which resides in lymphocytes, and since lymphocytes will circulate through the whole body, you have to agree that allergy or metal intolerance from immunological point of view is a systemic reaction. So it doesn't really matter where the exposed lymphocytes are there, and they will trigger reaction at the same time. And this is the principle of MELISA test actually, which is memory cell test. It stands for memory lymphocytes, MELISA, and this is an autoradiography of lymphocytes which has been exposed to the agents to which it reacted in the past. And then by addition in vitro of the same thing, of the same metal, of the same drug, you will induce these lymphocytes from the sleep by the same way as I showed you at the last picture. And this awakening from the sleep, you can measure in vitro by objective method. You can do it by, again, autoradiography or radioisotope tracing, or you can do it just by morphology, looking on the growth of cells, enlargement of the cells. So this is a sort of test which you can use to see if the body has reacted to two different metals and to mercury. Just to show you the situation is complicated, immunologically different mercury compounds do not cross-react. This is again the facts which people talking about toxicity of mercury never actually thought about. So in this case, I think we are a little bit more farther up. We know it's not just inorganic mercury. This is a phenylmercury I told you about. It's in different pharmaceuticals. Ethyl mercury is part of the thimerosal mertiolate, ethyl mercury thiosalicylate, and we are talking that this has two different antigenic epitopes. One is ethyl mercury and another one is thiosalicylic acid. And then you also have methylmercury here, and there is both of them are aliphatic molecules, and they partly cross-react. And I probably will not have time to that, but it has a lot of meaning in it. And there is a possibility that interaction between amalgam, inorganic mercury from amalgam, and ethyl mercury through this transformation of inorganic mercury to methyl mercury, which may then cross-react to memory cells directly to ethyl mercury. And this is from Ann Summers, which is vice versa a little bit. It just tells you, maybe I was thinking I'm going to Australia here. What it tells you anyway, it's that all mercuries will be transformed into the mercury ion, actually. So there is different ways how these things happening depending on the bacteria we have in our stomach and in our oral cavity. And this is such a simple picture for dummies, and I usually try to force to professors at our medical schools to look at that, and they say, we never heard anything like that. Is it really possible? And you say, yes, it is possible. And I told you about the bacteria like Staphylococcus mutans sanguis meteor, which have the capacity to transform inorganic mercury from dental amalgam into metal mercury. So all this talk about fish that very often it's sort of applied as a major source of mercury is not really true, because it's of course dental amalgam. We know that. And one of the other vicious things which I am not going to talk about is of course the impact of these metals on mitochondria and on the energy status of the body. And that's why I suppose a lot of antioxidants will work and will increase the energy level of your patients if they are metal toxic. That's what you know, of course, and that's why you use detox therapy to do these things. And this is the crown characteristics of these chronic degenerative diseases like multiple sclerosis, rheumatoid arthritis, and chronic fatigue and fibromyalgia. This is this sort of lack of energy. And the reason for that is that mitochondria is very rich in SH groups. Again, ATP, ADP, or energy is going there. And there are hundreds of papers showing that heavy metals will bind there, of course. Yeah, so if you detox, you will improve the energy, and that's why your patients will be better. But you, of course, have to remove fillings as well, because otherwise it's just palliative treatment. Yeah, this is just very few of reports which are in the literature. Nevertheless, they are. In men, it really is scarce, I must say. So many people who are devil's advocates and say, well, there is nothing which tells you that mercury will give any chronic low-dose effects. They may be right, because in literature it really is scarce. There is very little done in men. The reason for that is, as I told before I talk here, that most of the people working with these things are clinicians. So they have a lot of work with patients and getting everything around, finding also the authorities which very often try to interfere. At least in Sweden they do, here as well, as we know on EDSX. And these people then are impossible, or it's impossible to get time for that to publish something. And if I can ask you for, please do. Please send case reports to peer review journals about your informations, about your cases, which I know you have, because we need to have 100, we need to have 1,000 cases showing that after removal of fillings, there is an increase in the life quality, there is regeneration, there is rehabilitation. I know that you have observed this, and this is so. In Puerto Vallarta, I had a quite interesting encounter. There was a guy from Maui. From the meeting, I was lecturing on functional medicine, Jeffrey Bland, and at that time he asked me about fibromyalgia a patient of him, and I gave him some idea about detox and removal of filling. And in Puerto Vallarta, he met me and said, "Thank you very much for this advice. It worked perfectly well." So for me, it meant this is all over the world. The truth is the same. It's in Sweden, in Maui, in Carmel, but we need to do a solid research. And my hope is that maybe we can do something together. Very quickly, this is just if somebody who is here is a newcomer, just to show you that we have plenty of toxic things which we have in our metal fillings. And indeed, as Dietrich said, gold alloys are not inert, and even platinum, palladium, gold, cobalt, all these things may be quite toxic for individual patient. And root fillings, we have talked about it already. It's not just formaldehyde and metals. There are other allergenic substances like eugenol, for example, and everything this is published. All these things has been toxicologically screened, used in animals, found out that they will cause necrosis. So if you look into the literature, you will find everything there. Another from Scandinavia, endodontics, which also shocked me when I started to work with these things in '88, was that you really placed into the root fillings the most vicious poisons like arsenic or phenylmercury. And of course it was a goodwill to get rid of the bugs, but nobody actually thought that it will go into the body. So in Sweden, unfortunately, root filling containing mercury are still the facts, even if it's illegal. It's still used by the dentist. So if you have a patient and you remove his amalgams and he will not recover as you thought, or may recover just little. You have to look on root fillings, of course, you know that, and see what you get there, possibly to do testing. Malaysia, it's an old principle and it's a little new version of that, but it's actually well-established immunological test which is proving or disproving the body immune reactivity to chemicals and compounds. There is one, thank you very much, there is one thing which is important to note, and that means that if you have low molecular substances, like I talk formaldehyde or metals and so, the presence of memory cells in the body is going in parallel with the clinical symptoms. Because you also may have the test used for ordinary antigens, like tuberculin, streptococcus, bacterial antigens, and in this case it will just measure the immunity but not the pathology of immunity. So this test has been developed and is used in the context of clinical relevance, meaning that people who has exposure but have no side effect, they are lacking these memory cells and they have much less. And it's a blood test, and it's built up on the notion that after the reaction between the antigen or hapten, you want to know if the body reacted. You put it in vitro into the tissue culture, and if the memories sensitized T cells are there, these cells will grow up and they will divide, meaning that from the very low number of cells, one cells in 100,000 at the beginning of culture in your blood, you will end up in 1 cell per 100. So what it's actually doing is you are cloning out the cells which you can detect then. So it's very sensitive test. Unfortunately, it's little laborious test. It's nothing which you do in 15 minutes because you need to allow couple of days for this enrichment on this. So, and then you need to have a laboratory and at least a microscope when you can look on these things. Yeah, so this is again a little bit more what you do, separation the cells and plating them on the plates. And on the plates you do already have different metals, and we usually test the battery of 10 different metals. You can have 20, you can have 30. The limitation is only the amount of blood and lymphocytes, because you have to start from quite a few at the beginning, because the frequencies of these metal sensitive lymphocytes are very low. So this is the two types of differentiation or counting of your memory cells. For the laboratory, small laboratory, morphology may do the microscope. For the big laboratory or for research, we always do this radioactive labeling of the dividing cells, because if the cells divide, they will use isotope, which is a base which needs to be incorporated into the DNA of growing lymphocyte, and this then can be measured in the counter. Yeah, and this is a morphology things here. And the isotope thing, this is a standard beta counter which all major clinical laboratories will of course have this equipment for measuring. Yeah, so when we started with this, and as everything is a coincidence, and while I was working at Astra with drugs and drug allergy, I was never thinking to work with metals. But then '88, the thing happened, and I was asked by dermatologists to see if one could use this test, which I already worked with, to diagnose mercury allergy. And why was that important for dermatologists? Well, it was because it's ignorance or impossibility to test for mercury sensitivity on the skin. And the reason why it's so difficult, impossible, is because mercury is very toxic to the skin, meaning that even if you titrate, you can never ever be sure if you see the toxic reaction to the skin, just non-specific toxic reaction, or if you see something which is immunologically mediated coming after 2 days allergy. So I was asked this question, very simple question: could we look on people who has allergy to mercury, and could we see some different reactivity pattern in such people compared with people who has amalgams but who claim they are quite okay? And I did not know at that time what I am getting into. And somebody yesterday said something about the hole which is bottomless. And well, this is exactly the case. There I was 1988, and since then my whole world and my whole life has changed. And I realized that myself, my family, my friends, my relatives, everybody has been poisoned. And then I removed it and everything lifted up. And then I thought, gee, but we have to tell this everybody. And then I started to talk about it and tell it to some people. And they were people like you who came and listened and went to the dentist. And they were my superiors, which said, I don't want to hear it. I brought the book. We don't want to open this. It's emotion stress. It's emotional stress, and you shouldn't judge these people, because very often they are people who do not dare to open the book with the consequences what it may mean for them. When we are giving lectures, courses for dentists, many of these people will collapse because they realize they killed their relatives by placing golden bridge. So you shouldn't judge the people, because not everybody is courageous one. Because it's a hideous book, and once you open it, you never know what you find out. Yeah. So what we have started with was local changes in the mouth, so-called oral lichen, because if you remove amalgams and they are in the vicinity of these oral lichens, these will heal. So you have to say that that has something to do with amalgam fillings if this goes away. We call it clinical significance or clinical approach. And this was our positive controls, people with oral lichen. Sometimes they did have skin test positive, patch test positive to mercury as well. And as our control group, we have patients, or not patients, or patients to other diseases which came, but they definitely did not have any protracted fatigue, and they didn't have any oral changes. And then also we had a group of people without amalgam fillings, amalgam-free people. This was the same thing here. And these are quite complicated, and you just don't need to see quite big meaning into that. What it's showing is it's on this epsilon level, as higher these staples are, as more reactivity is there, as more memory cells are responding. This is the only thing which you are going to look at. And these on X basis, they are patient's codes. And in this case, we are looking on reactivity to phenylmercury, which is the red one, and low doses of inorganic mercury, which is the deep blue one. And then there is also reactivity of pale green, but you don't need to worry about that. This is the reactivity to high doses of mercury. So this one shows that actually majority of people with oral lichen are responding to phenylmercury and to low doses of inorganic mercury. But not all of them. There are some which do not respond. And if one looks then on other groups, so this is a group of dental nurses, control group, women which are working in dental laboratory, sometimes grinding amalgam by their on the palm of their hand. But as you see, there is no reaction to phenylmercury, no reaction meaning this is no increase in memory cells, and we usually have the baseline, the positive control, in about 3 times of the control level. And control level is if you just take lymphocytes and cultivate them, but without any metal. So this is so-called control in vitro. Yeah. So this Women has not have any problem. They often handled amalgam, had amalgam, but they are not showing memory cells under these circumstances to low doses of mercury or phenylmercury. But as you see, some of them will respond to large dose of mercury, and we really do not know what it is, if it's an immune reaction, because they may be immune reaction, or if it's something else non-specific. So if you are looking on the test and it's used for clinical diagnosis, you have to work with low doses of inorganic mercury, and this is quite in order. This is what we know, that how it should work. And these are amalgam-free controls, which shows the same thing. Most of the people will not react. There are some people who are responding to high doses of mercury. So you can say that people who have problems with amalgams or lichen planus, they do have memory cells which respond to much lower concentrations of inorganic mercury compared to control people. And this I will go, these are individual dose responses, and when we run the test, we do not run just one concentration. We run so-called dose response from very, very low concentrations, microgram, 0.06 micrograms, up to 10 micrograms per milliliter. And if you are sensitive, you have quite high responses here at the beginning. And this is dental nurse. This is again one single person now, which we are testing to all sort of types of concentration to see if there is anything which could induce lymphocyte, and it does not. So there are people who are truly non-responding to mercury. And the same here. Yeah, and this is a little significance. We will not go through that. All these things are now published and are highly significant. So this information is telling us that mercury in amalgam is really functioning as an antigen, and that you can measure this. You can screen for the reactivity and find out people who are susceptible, who developed this pathological reaction. When I have done that, I tried to publish these things, and it took me 3 years to get it to one of the best American immunology allergy journals. So it's published now, 96, but it took quite a while. And this is another drawback working with these things and trying to do decent science, because not only that you don't get any money to do the science, you also don't get it published, because on the scientific board there are people who are hating this, because most of the time they were laughing to patients and say, well, it's all in your mind. And then suddenly you come with a solid data which is proving the patient and disproving the professor. You don't want to hear that. Yeah. So there are a lot of obstacles on the way, and this explains why there is a little solid research done, because unless you have something special, as I had at Astra, because I helped them to rescue their most important drug, Losec. So my research did that they got Losec, which generates them 20 milliards a year. So that's why I got my share in research, but this is the only way. Otherwise, you don't get money. So, you know, it's really difficult, and I have no solution to that. One of the solutions is to raise the money and go to private foundation to allow more research, because it really is difficult. Anyway, this is published, and I hope that I will find possibility to implant this Melissa here in America as well. When we have done that, of course, we realize that one of the major symptoms of allergic reaction is that you are very tired. This is a logical thing. Everybody knows that. There is a hay fever season. People become very tired. And that's what we see in these groups of degenerative diseases like chronic fatigue or fibromyalgia. People have been looking now for years why is that so? Why these people are tired, and why don't they have energy, why they have to sleep all the time, or they can't sleep, and everything is dysregulated. And depending on the year, there was a switch in the causative agents of these diseases, varying between virus, bacteria, but also to environment contaminants. But somehow nobody actually got it into the perspective. So when we started to work with this, it just happened that we got a clinic at the Uppsala University, and Romo Hudecek, my colleague, will be talking to you in the afternoon. And from the whole Sweden, people were remitted there because they suspected that their chronic fatigue has to do with metal fillings. So it just turned out that we got a bunch of people there, and all the laboratory tests has been negative, as you know, but the people were still ill, and they claimed that it has something to do with their metal fillings. So what we have done was we have set up the study, and we compared the prevalency of metal responses in these people with chronic fatigue and the control people, which we have taken as an example. And this study is now finished up, and we have follow-up of 2-3 years. So we really know it has something to do with metal fillings. We remove them, and these people will increase. And I will try now to get it published. I only hope that it will take less than 3 years again. We had about 100 chronic fatigue patients. We have about 80% of healthy subjects. And there was no difference, significant difference in the spontaneous proliferation. This is a sort of general reactivity of lymphocytes in vitro, and also another unrelated antigen, which is tuberculin PPD. It's in Europe and in Sweden. All the youngsters get this as prophylaxis to not to get a tuberculosis. So these people, groups, control people with chronic fatigue people, they did not differ in these general proliferative measurements. While if we look now on reactivities against different metals, one can see that these are the percentage of positive ELISA test, and here is the frequency. That means 48 out of these chronic fatigue people, roughly 50% responded to inorganic mercury, to phenylmercury, and the other offending agents are nickel, which is of course expected because nickel is one of the most common sensitizers in Europe, but also gold and palladium. So this was roughly 1990-91. We started to get these strange results, because we have been reading in the book that gold is completely inert, and nobody is ever sensitized to gold. Suddenly, our lymphocytes were talking to us and say, this may not be true. And the question was, why is it so? And if it's really an in vitro phenomenon, or if it's something which really is valid in the world. And as it turned out, later on, now 93, 94, they are coming the data from dermatology clinics all over the world, from Australia, from Austria, from Germany, telling that gold is now the second most frequent sensitizer. Okay? From the people attending dermatology clinics, 10 to 15% showing skin test positive to gold. And I am talking gold as such, gold thiosulfate. It's not alloy, it's pure gold. The palladium going after that. We could have more discussion, why is that so? And I have the ideas, but that's the fact. So that means our lymphocytes 1990 told us already, hey, this is not like that, it's like that. And it's not just that bad. We have some other metals which are showing higher prevalency, which we are really not know what to do with it. And this is cadmium, for example. We do not have skin testing for cadmium, so we don't know what it means. Titanium is not a biocompatible inert. We do have persons which are reacting to titanium. So just to tell you again how skewed all discussion about amalgam is and about mercury, because it's just top of the iceberg. It doesn't mean that if you remove amalgam and leave inside all screws in the root fillings and gold alloys, that the patient will be happy and jump. Maybe temporarily, but then if you even get more, so it's even worse. I don't want to scare you, but these are the facts.
Where does copper come from?
Copper is there, it's toxic, but it's very, very little allergic reaction to copper, which we can see, yeah. And the same for silver, very, very, very low sensitivity as far as allergy goes. Yeah, these are just the data. You don't need to read it much. They are for different prevalency and p-values. So you have the good ones when you have chronic fatigue and responsiveness statistically highly significant for mercury, phenylmercury, gold, and palladium. And then I told you about the transversion between methyl mercury and inorganic mercury and also reactivity. While there are other ones, tin, platinum, lead, cadmium, titanium, ethyl mercury, nickel, when we do not see the differences between the group, which are not significant. But that may just mean that there are very many people who have different diseases or they have some latent problems, but they still do react. Very little which we can pick up. Very little, yeah. So which is, I think, quite okay because it's not transitional metal. It doesn't bind by the same way as metal do, these heavy metals. So if you are in the business of good science, your supervisors, they will always ask you to tell the test and the wellness of the test by sensitivity and specificity. So we have done something like that, and we have counted the number of negative and positive tests between these chronic fatigues and healthy individuals. And I think I just had a couple of these things talking about sensitivity, which was about 83%. And then sensitivity was the same. I think I lost the slide. And then there is a predictive value showing in how many of these people with chronic fatigue will have these positive reactions to one or three of these metals, which there was a big difference between the control group and sick group. And the predictive value of positive test in this case was 80%, which is very high, and negative is also 80%. I have to stress thought at these people, these chronic fatigue, which we put our hands on, they were selected, of course, because they have been getting to the clinics and they already knew that the clinic is interested in metals. So there may be that there is a selection of people. On the other hand, the test is now run in Germany, and I have a data from Munich, from the laboratory which has now run about 1,000 of MELISA tests, and they do find the same prevalency in their material. That means the leak is led by nickel, then mercury, inorganic mercury, phenylmercury, gold, and palladium. So we say we have two completely different laboratories, or actually three, because there is one more laboratory in Germany, in Uppsala, which Romwald is coming from, who are running the same things, and they do find the same. And then besides, we also have a group in Japan, which I have a couple of slides, if we have place here for that, who has also shown that people with atopic dermatitis, people with different skin diseases, if they are reacting in vitro against mercury, palladium, and gold, and if you remove these sealings, the reactivity will go down and the patient become healed. So this is nothing which is European, this is nothing which is American, it's a worldwide catastrophe we are reaching at. And we are too few to fight this giant, but way to get it on the paper, to make it objective, to make a solid research, this is the way which will bring us to victory. I am absolutely sure about that, but we are on the track. Yeah, this is why we are sometimes doing also patch tests. I will not go into that. This is a slide which is a little old now. I think it was 1 or 2 years ago. At that time, 64 people of these metal-sensitive people removed their fillings, and Romuald will talk more about it as the end result, and they also do get some antioxidants therapy. He will also talk about it. And roughly 80 to 90% become better. Many of them will be completely cured. The ones which will not become better or which become worse, they were the people who went to dentist other than Romuald, and just accidentally this dentist placed maybe golden alloy to these people, and then happened that they become worse. We have now follow-up on these things for 2-3 years, and follow-ups, it's not only that we give the patient an inquiry and ask him to know how he's feeling and so on. We are also taking the laboratory tests again and to see what's happened. And this is what's happened in majority of people who are better, is that their original Melisa reactivity, this is during the removal, and these are after removal, it's dropping down to palladium here, while to nickel it's still there. So what we have now, it's a biological marker which can tell you if the dentist has done properly his job. Because if he did, memory cells which are feeding on metals present in the body, if the metal is not there, they will go down and they will die off. And usually these people are very motivated and they are really avoiding all exposure. This is another one, another patient, and this is also, you see in this case here, the increase of reactivity up from the beginning, probably due to the fact that there was a dentist who didn't protect the patient quite a lot. And then nickel, it's again, it's staying there because it's very difficult to get rid of nickel exposure because it's everywhere. This is one of young patients, and this is a complete story which again awaits the publication, but it tells you that you can really do quite a few things. This person had a chronic fatigue and wanted to commit suicide. He was 22 years old and he was already 8 years circling around the doctors, and they told him that he is work shy. He doesn't want to work. And say, well, Vera, he called me and say, if you don't take the test and so on, I kill myself. I don't want to live like that. So he came, and I had a dentist, which I refer him, and he was really unfortunate one. He had that dysplasia in the mouth, in the front teeth, meaning that he got these cold crowns in very early age, 16 years old. And he was the example of the body trying to fight it out. Because when I read his old journal, it was there that this gold crown didn't stay. They just fall out all the time, and they were glued up again. Anyway, he had these gold crowns, and the gold crowns have quite of different metals in them. One was called merit, another one is 75. It's a gold alloy, and you can see that in addition to gold, platinum, palladium, there is also tin, and there is also indium here. So his tin is both in gold fillings and also in amalgam. And it happened that when we ran the test on this unfortunate boy, that his reactivity was not against mercury, but it was against tin. So in this case, if you would just remove amalgams, he wouldn't be better. So that may explain why a couple of your patients, even if you remove amalgam, they will not become better. Because in this case, there was reactivity against tin, and there was reactivity against palladium and thimerosal. And these are just two concentration, maximal concentration, and this is the positive control. And as you see, without Melisa, you would never know. In this case, we knew that both of his gold alloys contain tin. So this was quite clear that they have to go out, everything. So this is what the clever dentist has done, and it was 91. He removed, first of all fillings, all amalgam fillings. and he made a new composite fillings of helium molar and Kell life. And then he took crowns, metal bone crowns, and removed them and cemented. And then he placed on metal-free white in ceramic crowns. And then he removed this bridge also, and he put another one. So that's what he did. So you can do quite a big things with metal-free materials, and Romuald will tell you about this. So what happened then was a sort of fairy tale, because the guy recovered, and he is happy since then. And these are the symptoms which has disappeared following this rehabilitation with metal-free material. If you are not aware of the symptoms which are caused by chronic low-dose permanent inflammation in the body, you would not believe that, of course, and that's what people do not believe. But luckily, we had a follow-up now for this person. This is also everything like that went down, and these still have some symptoms unchanged, and they were the ones, but he could easily live with that. When we ran up MELISA test, then in August '92, we could see that his reactivity to tin and palladium went down now, and since then it stayed there. So we are regularly having contact with this guy. He's now 28 years old, and he's everything except work shy, and he's working full time and likes his life. Yeah. So you know, this is how it is. You can really make a healers when you know how to do it. I have a couple of more pictures. They all are the same. What they tell you is that there is an individual reactivity mantra, and you have to know that. If you do it by kinesiology or if you do it by other means, we are not all the same. So this is another chronic fatigue. What you can always see, it's the relevance of MELISA to clinical symptoms. You find these patients, if you ask them how they feel after the drilling and after the cleaning of gold polished surfaces, they report to you that they got a flu. Yeah. So that means it's not the flu, of course. It's positive provocation test in a metal sensitive patient. Yeah. So this is it. Here is a mercury, here is gold. Here we have also a patch test which shows you positivity to gold here, and this is the reactivity here, but also reactivity to cadmium, lead, sometimes the things in root fillings. This is a person with only amalgam fillings, focal oral problem since 90s, and reactivity to mercury, phenylmercury, and also titanium here. And this is a sort of successful rehabilitation, the chronic fatigue, which is already past, much better, and quite often by removing, partial removing, and this operation, what's happening is that you are actually exposing the body with low doses of these metals, and somehow these lymphocytes will fall down and die off. So you are actually established some sort of desensitization by these things, and as you can see this. Yeah, this is a summary slide. Actually, all sort of diseases, so-called autoimmune ones, we could detect metals as a confounding factors. I'm not now telling that all the diseases are induced by metals, even thought very often I think so, but I will not tell that because this is quite ignorant. But what I am absolutely sure is by removing the load of the body, removing the cause of chronic inflammation due to the metals in metal sensitive people, you will result in healing and possibilities to heal the person. So even if the first cause was something else, the body will override that and will become healthy. So that's what I think this is valid. This is another study which is now ready for publication, and these are children with diabetes. There is quite interesting connection to juvenile diabetes, because you know this is the disease on the rise. It's a modern disease. More and more children are getting that, and you can just think about where in the pancreas the action, the cellular immunity is. This is in beta cells, and beta cells, what do they contain? They contain zinc. You have zinc fingerprints. And what is the metals which is competing zinc at best? It's mercury. So if you have reading papers from one Danish group, they have taken radioactively labeled mercury and gave to the pregnant rats and looked by autoradiography in the offsprings, and they found the radioactive mercury not only in the brain but in the pancreas, because zinc is there. So our children with diabetes, we have looked on different spectrum of their reactivities and compared with control children, and found that majority of diabetes children will respond to mercury, low concentrations of mercury, and also to palladium. And these differences are significant now. These are children without any diabetes. There is still some who do respond to mercury, but there is virtually now none here who responds to palladium, and the results are highly significant. So there is a paper, and this will have a quite profound meaning, because despite of importance of chronic fatigue, the fact that it's a woman disease, it's always make it a low priority disease, unfortunately. Well, we have to face the facts. While if you are looking on children, everybody is interested, isn't it so? Palladium is coming from different sources. One source is a metal exhaust from the cars. Another one is jewelry, and it's passed through the blood, not through the blood, through barrier, fetal barrier in a women. And we have actually another study which we are doing now, follow-up, and this on study with cord blood cells. We have taken cord blood from children while born and look at their reactivity, and we already can see that a couple of children will respond to mercury and palladium nickel already sensitized in uterus. So these things are quite powerful things and quite hideous things. So it doesn't mean that if you are placed one amalgam and you precipitate disease, that it's you who have done the disease. It could have been a smoking of the mother of the child, because smoke contains nickel, cadmium, and lead. And if the mother went to the dentist during the pregnancy, the kid got it as well and started to get it there. Yeah. Cardiovascular disease, you know, of course, the data of Siblerud, who is talking about, and this is something which is not surprising at all, because the newest data on cardiovascular disease are talking about the free radical formation and precipitation of stroke by this. And as I told you, titanium is at the same place as mercury, or as iron or palladium or nickel. All of them are so-called transition metals. That means transition metals is that it's not stable. It's a metal which is seeking for a lacking electron in outer orbit to make an electron pair. So that means that all these metals are binding strongly, and they are promoting free radical formation and triggering inflammations. So that's why cardiovascular disease is now treated with increasing interest from mainstream medicine through antioxidantia, I vitamin and so. Okay, sorry, just taking this ever. Yeah, these are the abstract of the things. And this is one 18 years old girl with strong reactions to influenza vaccine. It's coming up here.
But she also had some broken thermometers, which she has been exposed during the childhood, and she got precipitated quite serious cardiovascular disease after the insertion of one single amalgam filling. That was the only thing she had, one single amalgam filling. But on the cellular level, you see the multiple reactivity to different things, which probably precipitated then by this influenza vaccine. Yeah, I think we just skipped some of these. These are different things. This is neurological diseases like vasculitis, MS. I would like to name them. In our opinion, very often these are triggered by mercury, phenylmercury, cadmium, and lead. Again, there are no strict tests on skin on lead, but lead is a neurotoxin. This is accepted, and our lymphocytes in a couple of these people are telling us that lead, which is, for example, in lipstick and in cosmetics, we have bad cases of progressive multiple sclerosis in young women, which were sort of so much up to their cosmetics that I think it laid them into the grave, because they were strongly responding to brands of cosmetics which contained lead.
Smoking also?
Lead.
So secondhand smoke and things like that?
Yes, lead. This is again vasculitis, gold thimerosal. And MS study, we do also have a study, MS study, which shows about the same things, that very many MS patients have a strong reactivities, not only to nickel but to other metals. This case, this is a person which got relapse of his sclerosis after the drilling of gold crowns. In this case, there was nickel and palladium in the gold crowns. This is what we do find, that even then nickel is actually prohibited to be used in gold crowns. Some technicians will just take out the gold and put in nickel coins without really thinking what they do. And of course, then it has a problem. Yeah, this is the platinum for you, Dietrich. The one, it's quite rare, but there is. There is a chronic, that was a nurse with chronic depression and alcohol problems. There is quite interesting connection to alcohol here, because as you know, if you drink alcohol, you decrease the absorption of mercury from your fillings, meaning that couple of dentists which may have a problem with alcohol, actually they protect themselves. Yeah. That doesn't mean that you take the bottle immediately. Okay, so in this case, we could pick up a rare reactivity to platinum, and what is interesting here was that at the same time this nurse has got a lumbar puncture. And just by coincidence, instead of looking only for mercury, they did look for platinum and found platinum in the liquor, this woman. And she had a platinum-containing golden bridge. So, some way or other, the clinician was very surprised and say, hey, where does this platinum come from? And I said, well, from her golden bridge. Yeah, so that was that. Yeah, multiple sclerosis, quite of many people will have strong reactivities to mercury, as I told you, but not everybody. And there will be some which will respond to lead, cadmium, and nickel. Everything on the individual reactivity, meaning that if you have a patient who got everything, root fillings, amalgam, golden alloy, where do you start? I don't think it's the way how Munich does it, that you just throw out all teeth. It's very radical. If you have possibilities to randomize a test, it will tell you where to start. Yeah, could you change? There is one more couple of slides, then I am done.
Vera, can I ask you a question?
Yes.
I think relates to everybody. is the reaction that people have dose dependent? That means, like, let's say if from 9 crowns you remove 8, or is 1 then enough to maintain the reaction?
Yes, yes. The question was if the person has 10 golden bridges and you remove 8, if the 2 remaining ones or 1 remaining one, it's enough to continue your allergy, and of course it is. Yeah. So what we very often find is that the improver doesn't start unless you get the last one screw in root fillings out. Then it comes up, and Romuald will talk and show beautiful data showing that the rest of the amalgam in the tissue, just little one, and when you get this out, then it is. Or you can't use, for these sensitive people, composite with metal pigments, because you have composite which contains metal fillers. And if you have a person which is reacting to titanium and you remove everything out and you give him heliomolar with titanium in it, he will not be better. So this is the problem. So again, the same thing here. And the same thing here. I will just go very strictly for it. MS patient, optical neuritis, that is how it starts in 90. Exposed to amalgam, MK Crohn's and root fillings, and this TMS screw, that means metal screw in root fillings. You have to get rid of those. And reactivity to gold, to titanium. After the removal of amalgam, you get relapse. So we usually give steroids, and we try to remove everything at once, just to low down the immune responsiveness first. Yeah.
Does the TMS screw somehow radiate out the dental tubules or something like that? It's buried so much in the tooth that.
Romuald can.
Okay.
Yeah. Yeah. Yeah, and again, well, it's all the time the same. Nickel, 80 to 100% of your MS patients will respond to nickel. I think you know this situation. Also, palladium, the same. Physician, she is a friend of mine. She's now completely healthy from her progressive sclerosis. Her only reactivity, she just has amalgam, was mercury and nickel. Now she's, it's about 10 years follow-up now, 79, yeah, soon it will be 10 years now, which is still okay. And these are the control data controls, people who has amalgam and gold fillings, and they do not, the lymphocytes will not respond in vitro. It doesn't mean that they are not affected by toxic or biochemical means, but on immunology side, they take it. I just had one more thing here for you, and this is penicillamine, because if you look in literature and look on the side effects of penicillamine, and penicillamine is a drug of choice for rheumatoid arthritis and for treatment of multiple sclerosis. It works, it improves the disease, but it's not too much used, and the reason why it's not used is that it has a serious side effects. And if you are now looking into the medical books and look on the side effects, peripheral neuropathy, Guillain-Barré, myasthenia, nephrotic blood, vision, optic neuritis, and tinnitus. What does it tell you?
Heavy metal.
Yes, heavy metal detox. It's a chelator of heavy metals, meaning, by definition, since the people with rheumatoid arthritis or MS are taking this and develop these symptoms, and then they become gradually better, what you are doing is you're removing the heavy metal load in people which are sensitive to metals. By definition, it means that their disease is caused by metals. This is already published. Everything is done there. Yeah? I haven't seen the data on rheumatoid arthritis patients or MS patients measuring and monitoring their levels of heavy metals in urine and feces. I haven't seen that. Nobody has looked at it, but it's all there. Yeah? So that means, again, we have a lot of indirect data showing that it's not only in animals but also in man when these things are precipitated or so. Yeah?
Vera, how would you use penicillamine? What is your protocol for its use?
I am not a physician, maybe somebody is here, but it's in the standard medical books. So yeah, this is very straightforward. You just look at it into the. Yes.
What the side effect is? You get rid of those symptoms of peripheral neuropathy.
You get these symptoms.
You get the symptoms.
40% of people on these drugs get these symptoms.
Vera, can I say something to
Yes.
that? That's why we always said when the metals come out in reverse.
No.
So I'm just talking as a
Yeah, go on. Go on.
That's what we always said, when the metals start coming out, when you give an agent and pulls the metals out, they're going through the system from from the deposits, and the deposits, the body puts them in place where they're relatively inert. And then once you start mobilizing the depots, they flood through the system, and on the way out, they're causing the symptoms that they caused on the way in, but acute rather than chronic. On the way in is chronic low grade. On the way out is acute. And many people have mistook that reaction with the DMPS. Many patients are complaining that I got this problem, a hip joint, or this and stuff. It's the metals coming out. They wreak havoc on the way out, and that's why we came up with the protective programs, with the chlorella, with the cilantro, with the garlic, the things that protect the body, with the DMPS, and to give that protection now, in addition with the allergy treatment that Doug and several others are doing.
Yeah, that's exactly. So it's actually the final proof, because if you talk to clinicians or allergologists, they say, well, hell, with all these in vitro tests, the final crown proof of the clinical relevance of the agents to your disease is provocation test. And this is exactly what it is. If your person, after the removal of fillings, get this cold, get joint problems, so this is the proof for you that metals has something to do with his health. So it's actually protecting you. So that's why you should always ask and say to your patients, get back to me to see how you are doing. Please do that. And if they say, oh, I became so ill, so that's it. Because this is temporary, but it will improve again. So I just finished up with the notions that the biggest plague of modern medicine, modern regenerative diseases, instead of seeking palliative treatment, what school medicine does, we are looking for etiology and the ground of the disease. And if we can find that, we can successfully treat and we can rehabilitate the patients. And my hope is that politicians or people who are giving money for health, for sickness leave, will understand that and alliate with us, because in Sweden at least, politicians do. What they have to find with is a medical profession which feels threatened, not only by scientists, but also by dentists, of course, because they are then moving. And then I would like to invite you for the meeting, as I told you, in Alps and in Sweden, in Stockholm. If you think this is something which you would like to learn more, if you would be interested to send the blood for testing to Sweden, it's possible now. Come and join us in Sweden. And I have to quote one of the greatest thinkers of our world, Art and Schopenhauer, in their notion that sooner or later we will win. Thank you.
What are the dates between?
Date of the what? Okay.
Questions?
Yes, yes. Okay.
When is the meeting?
Sweden seminar. I have some things, and this is in Stockholm, 24th to 26th July, 97. Yes, we can have more. And then there is in April in Austria skiing. Yes.
Here.
Yeah, I will read for you, and maybe I can write it down for you, and then I can take some questions.
while Vera is writing on the board, just kind of be quiet for a moment. I just wanted to tell you about Vera a little bit more. She's been making friends with Ed, over the last years, and she paid for her own trip to Carmel from Sweden, thinking of that she, I personally kind of want to. That you may not know, but she is a very respected researcher in Europe that scientific minds know over there. She's not one of us underground kind of in the dungeon or back in the garage kind of working people. She's sort of like officially recognized master in her area.
Like us, teacher?
Vera, I have a question while you're doing that.
Yes.
Your first slide you put up there showed an injection of a child with thimerosal. I assume that was the vaccination, right?
Yes, that was, yeah.
And I've always had an idea, and I've talked to Mr. very well about why we all get
Yes.
vasculitis.
Yes, yes, yes.
Are we being set up as infants for sensitivities to mercury by getting an injection that's preserved with thimerosal, so that when we go to our friendly local dentist and have our first mercury filling placed, is there a localized vasculitis as a result of that, causing ischemia, bone death, etc.?
It was a question. It was a question. I didn't have time to tell you more about it, but ethyl mercury thiosalicylate may cross-react to metal mercury on the level of memory cells, meaning that you can make a lightened sensitization to ethyl mercury, which will then cross to metal mercury, which is used to release from amalgam fillings. So there is a reaction, and myself, I have this reactivity to metal mercury, and I was abnormally tired all my life, and well, I didn't know about it, of course. I always wondered, but I sort of blamed it or a lot of work and kids and long journeys and so on. No, not parents. I had a very lucky childhood, so that was not. But I wondered, but all these things got away when I removed my fillings, but I did not respond to inorganic mercury. I respond strongly to metal mercury, and this reactivity was potentiated after removing of the fillings. And the same with ethyl mercury reactivity. So I know that there is a reaction there. Yeah.
What's the procedure to send blood? Do you send blood for
Yes, I would like to have somebody who could, or several clinicians who would like to cooperate, and maybe we could have a tomorrow in panel discussion. We could take it up and broach how to do it. The fact is that we have now this procedure working from Germany, and they are sending. It costs up 150 Deutsche marks, and it's taken in the afternoon in the middle of Germany, and in the morning it's in Sweden. It works perfect, so I don't see the reason why it shouldn't work from here. Yeah, no problem. Yeah. Yeah, I see. We have to set up, it would be good if there was a small laboratory which could maybe separate the cells. So there are special tubes, Becks and Dickens tubes, which you can just spin down the cells, and then you take the blood and send it. Yeah. So it's possible. Yeah.
An important question that was mentioning, like when you remove the offending metals, all the indicators in the ELISA test sort of tend to go back to normal. That would indicate to me that the test is very good to check on the stuff you have in the mouth.
Yeah.
But can it be used also as a predictor of what to put in?
Yeah, you can actually, because you don't have much choices, do you, on the part of metals to put in. So if you would like to have a titanium bridge, which is one of the options, titanium is everywhere actually. As I told you, it's in the food, it's coloring, so there is actually no person which is not exposed to titanium. So if you check for titanium and it's negative, it's pretty okay that you can use it. Yeah.
I did some research on pure titanium in the mouth. It may test negative on immunoprofiling, produces a very high electronegative charge reactivity in the body.
That's maybe.
Clear of the test. When you put it in the mouse.
Yeah.
It's just like it's bad as nickel.
Yeah.
And let me say something. Don't mistake the ELISA test with the RAS test. Very different story. Yeah, don't mistake what you've learned, like what you indicated by using the RAS test or one of the other immunological tests with this test. This test coincides very deeply with clinical reality, whereas the RAS test does not.
This is on memory cell level, so it takes up all sort of immunologic reactions. RAS does just serum test and just IgG or humoral antibody. But I agree with you, the titanium is really not sort of choice for metal sensitive people either. So what ELISA may give you, it may give you the hints if the person already removed his amalgam filling and isn't well. And he did 3 or 4 beautiful gold bridges, which costed him $1,000. Do you have the heart to turn it out without actually having anything in your hand? I mean, this is the point. Yeah. Yeah.
Have you had any experience with the porcelain derivatives like feldspar?
This is everything is dentist's business in the afternoon. We have to separate quite a lot, you know. Yeah.
Experience on bisphenol A and composite fillings?
No, this is again dentist, isn't it? I'm sorry. Yeah. Yeah. It depends very much on the strengthness and frequency of your dental visits. If you have somebody who goes during the year 20 times to the dentist and taking part by part, and you desensitize quite quickly, but usually it drops in half a year, very quick. Yeah, yeah.
What is the month of that fourth seminar on board?
The April the 10th and July in Stockholm, July. Yeah, and I will leave some of these behind, and maybe we can do an overhead so you can have it in the afternoon. Yeah.
Could we get the tubes from you from this address?
We have to, it's actually Becton Dickinson is an American company, so I think you can just order it here. This is nothing special. Yeah. So you can have the things what do you want to buy here? It's nothing you need to get from Europe.
Let's brainstorm until tomorrow, you know,
Yeah.
tomorrow we have
We can see how we can organize this.
and see if we
Yeah.
can make some suggestions
Yeah,
tomorrow.
yeah. Okay, I think we have lunch now. Yeah? Okay, go on.
Did I hear you correctly when you said that there was a close link between juvenile diabetes and mercury?
Well, there is at least theoretical link, and 90% of our kids in this study got diabetes following the insertion of amalgam filling.
It's intriguing because I know there's recent data to show that juvenile diabetes is very closely linked to milk sensitivity. I'm wondering whether perhaps the milk might be...
Yeah, there may be some links. There is a controversy regarding this milk thing, but there is a data showing in rats that if you have the rat's offspring exposed to mercury or metals and you feed them on milk-free diet or on milk diet, the offspring on milk diet will be thick, not the other ones. Meanings for me, it's probably a lot of fat in the milk which may push your metals through by the better way. So it's a sort of permeability or something like that. Yeah, and the same is with venous vasculitis. I know the patients with venous vasculitis who are drinking copious numbers of milk, liters of milk daily, and they become much better if you remove the milk. Maybe it's again the penetration of metal ions release and taken up by fat containing in milk and taken up in the brain. Like EDTA, it will get it through. So maybe something like that. Yeah, protein. Yeah. Well, this is other story. We evade the publication first. They don't want to do anything. But they give them chromium and zinc and antioxidants already to this. Yeah.
Vera, between the ELISA test and the Seramune test that Jaffe's
Yeah.
Can you speak to that?
Yeah, I can speak to that, and I am just sorry, I don't know if Cliff is here, that he was not willing to do any joint study, because histocompatibility testing is measuring something, but I really don't know what it does, because this is a known fact which is used, for example, in pathology. In MS, you use so-called golden stain. It will stain, gold will stain proteins in the liquor, and so it has the capacity, metals have capacity to precipitate proteins, and this is exactly what's all about. So I think what it may do is that it may measure the immune reactivity of the body, maybe. The thing which makes me very thoughtful and very careful about the test is the fact when I first came over to Hal Huggins in Colorado and started to talk to Hal and ask him about the gold sensitivity, and he says to me, well, it's actually non-existent, and it doesn't fit. Maybe you can ask about that, Cliff, about the gold. Why histocompatibility test doesn't pick up gold sensitivity?
It's not this test that she refers to. She refers to Russell Jaffe.
Oh, that test.
Russell Jaffe knows
Yeah.
very
Yeah.
well the study.
Yeah. Well, we were talking to do some cooperation, but never worked out. I can't comment. I don't know much on the test at all. It's sort of cytotoxicity test, but I am not aware that he published something.
He developed. He
I don't know.
studied Vera's test very carefully,
Yeah.
and then designed this test. So this test is an offshoot of this one, but with undisclosed propriety things that he put in there.
Well, I don't know about anything about it. He definitely didn't ask me more closely on that.
He knows it very well. He's studied all
Oh, yeah. Okay. Mm-hmm. Yes. Well, that's what I told you. That's why you used by the penicillin. It may be as simple as that. I told you, maybe gold is inducing rheumatoid arthritis. And you know that, and that's why if you give a small doses of gold, you desensitize the system and keep your memory cells under the charge, and then maybe you feel good for some times, but not like as simple as that. You have also anti-inflammatory effects direct through gold and other things. But definitely many people who have gold sensitivities, they, as a second day after the removal of filling, or after the polishing their filling, they get pain in their joints. And collagen is full of SH groups. So it shouldn't surprise me at all if we could say that in many women with arthritis, it starts with placing gold fillings. Yes, it wouldn't surprise me. Yeah. Okay. Yeah.
Could you finish your thought on your talking about the reactivity of Clifford test?
Well,
And why so many of the golds do come up?
I don't know that. Do you know why don't you pick up gold reactivity, Cliff?
Vera, we do pick it up, but I think in many respects our test populations are somewhat different.
I don't know.
We are broad spectrum where we don't get quite the clinical separation that you do.
Yeah.
But we do see gold.
It's sort of, Cliff's test is sort of a screening test, yeah, which can give you some indication. ELISA test is more specific. It's of course a little bit more expensive. There's no doubt about that. And we have data published, which I think, and I always ask other people do the same, because this is the best way to put forward the knowledge. Yeah.
So people would say if you clean the amalgams, if these people have still sensitivity, and you have little amalgam tattoos here and there, that's still going to be.
This is again what Roma is going to tell, and unless you clean it up, it will not go down. Yeah. No. Okay. Everybody, yeah? Sorry? We have to work it out, depending how many test metals you want to go. I suppose it will be between $300 and $400. for a test of 10, 15. Yeah. Okay. Thank you very much.
Good job.
Yes, thanks.
Very interesting stuff.
Yeah. Okay.
A couple announcements.
Excuse me. Could you tell me
Nick
about
still needs
the
a
goal,
room,
88% goal, 88% goal?
Yes.
And then all those people that are meeting for lunch with Nick in regards to Nick's program will
Okay.
meet right
Just a
outside
minute.
here.
Yeah.
Another announcement from Underline Enterprises.
That's with you.
Anyone signing
Don't
up
try
here
to
for either
use
the
any
seminar
kind
on
of goal.
June 5th
No.
No goal.
in
But
Scottsdale,
24 kilats per goal
part of that,
is not good.
the
24
tuition fund will go to Ed
Well,
Aranda.
I don't know. I know only
I'll
that,
make
that
that
some,
later
there are
on
many
too.
people
So
who are
those of you
sensitive
signing
to
up for the
gold.
Underline
Any kind of goal.
clinics
No.
in
Thank you.
Scottsdale
But I mean,
in June.
there is a goal, 88% goal.
Yeah, but it doesn't matter for allergy. It's
Allergy is allergy.
yeah.